So let's just recap the indications for inhalation sedation. Dental anxiety is going to form on many of the patients we treat in this way, and those with needle phobia more specifically are very much helped by this form of sedation. People who have hyperactive gag reflexes, it can really help those patient groups to get some simple treatment done. People having procedures that they might consider traumatic can be really helped. So patients who don't have dental anxiety, and in a way we're preventing it. Medical conditions that are aggravated by stress, again, we can prevent those from being exacerbated by using inhalation sedation. Now let's run over the contraindications to inhalation sedation. So when shouldn't you use it? Well, the first and most obvious is someone who can't breathe through their nose. So that could be someone with an upper respiratory tract infection or tonsillar or adenoidal enlargement. So ask a patient, can you breathe through your nose? And ask them when you're intending to provide inhalation sedation too, because it's just not going to do anything otherwise. Patients with serious respiratory diseases most probably would be ruled out from your inhalation sedation selection criteria by virtue of their ASA classification. However, just bear in mind the way that these patients are driven in their respiration is not by carbon dioxide levels, as most healthy people are, but by oxygen levels. And so if we give them inhalation sedation, then we're giving them with a lot more oxygen than they would normally receive, and their respiratory drive can completely drop, meaning they go into respiratory arrest. So not patients worth considering for inhalation sedation. Pregnancy. We've talked a lot about the effects that nitrous oxide can have on cell growth and neuronal formation. With this in mind, nitrous oxide is to be avoided wherever possible during pregnancy. However, it is used frequently as in labour suites, and so in the latter stages of pregnancy, a risk-benefit approach could be taken where a patient, if they're not able to get treatment done by other means that could affect the health of them or their baby, full discussion and full consenting of the patient might mean that an experienced practitioner might undertake this, but worth avoiding where possible. Some patients just can't wear a mask. It can make them feel claustrophobic, and that is enough. Or they can make them feel like they're being tied down, and the fact that our coaxial tubing does need to be quite firmly attached to stop the mask clipping can be enough to put a lot of patients off, and patients can have negative memories of inhalation sedation because of that. Some patients just can't breathe through their nose, and they're chronic mouth breathers. Very young children. There are some groups of patients who might not be able to follow the instructions you're giving them or be able to understand the hypnotic suggestion and behaviour management you're trying to provide them. That can be patients with moderate to severe learning disabilities or those who are very young, so young children. People with severe psychiatric conditions should be avoided when providing inhalation sedation for a number of reasons. The medications they're on can be tranquilizers and have significant sedative properties which we don't want to additionally put nitrous oxide on top of. Also, their psychiatric condition might be unstable, and adding or giving them a dissociative out-of-body experience really wouldn't help them out. When we talked about the consequences of the solubility of nitrous oxide and the fact it's poorly soluble, I mentioned eye surgery. So for a patient who's had eye surgery within the last 3 months, avoid nitrous oxide sedation. For patients who've got middle ear problems, it's very much worth consulting the doctor who's responsible for that, and that might be an ENT physician, to work out whether it's appropriate to give them nitrous oxide sedation. And finally, we talked about methotrexate users. There isn't evidence specifically to say avoid it in the concentrations that we're talking about and the durations that we're going to be providing them for during inhalation sedation. And so a risk-benefit approach can be taken when discussing with the patient.